Hi everyone, it's Tatiana Rivera, and this week I'm going to go ahead and palpate the bony landmarks of the lower axial skeleton, including the lumbar spine and the sacral region. This is my patient Claudia. She's already given me consent to go ahead and palpate, so we're just going to go ahead and begin. All right, so the first thing I'm going to find is the spinous processes of L1 through L5, the lumbar spine. Okay, so for what's easiest for me is to go ahead and look for the 12th rib. Okay, I'm going to go ahead and find the 12th rib here. I'm going to go in medially onto the spine, and I'm going to be right at T12. Okay, so from T12, I can go down inferiorly, and I'm going to find L1. So there's my L1 spinous process. I have L2, L3, L4, and L5 spinous processes. Okay, if I go just laterally from the spinous processes here, I'm going to find and I'm going to feel a little bit of a groove or a dip-like feeling, and that's going to be the lamina groove. And right here I'm on L5, so I'm on the lamina groove of L5. Okay, and I'm just going to go up, and then right here I'm going to be on the lamina groove of L4, lamina groove of L3, groove of L2, and the groove of L1. Okay, then from here I'm just going to go a little bit more laterally. So you want to go to about 2 inches laterally up from both sides from the spinal column. Okay, you want to pass the thick muscle group of the erector spinae muscles. Okay, and from right there you can go ahead and find the transverse processes of the lumbar vertebrae. Okay, so from here I'm on the transverse process of L1, and you're going to go down all the way. And you're going to go all the way down to L5 of the transverse processes. Okay. From here, now that I'm on L5, I'm going to go back onto the spinous process of L5. From here, I'm going to go ahead and find the posterior superior iliac spine, which is the PSIS. Okay. Sometimes you'll have patients that will have dimples on either side here. That's usually the indicator of where the PSIS is. And if you don't, what you can do from L5, just go ahead and go laterally here, and you're going to feel little bony projections on either side. If you just move your fingers side to side, and then right there I can feel her bony projections of the PSIS right here. Okay. Now from here, going back to L5, so I'm just going to come in medially here. From L5, I'm going to go ahead and find her the base of the sacrum. Okay, so I'm just going to go a little bit inferiorly. And then right there, I can definitely feel that bony structure of the base of the sacrum. And then if I go more inferiorly, as if I'm going down to the gluteal cleft, right there, that other bony landmark is going to be her the apex of the sacrum, right in here. Okay. Next, I'm going to go ahead and find the SI joint, or the sacroiliac joint. So once again, I'm going to go back up to L5, and then go laterally to find my PSIS again. Okay. And then from here, I'm going to go a little bit laterally, and also another checkpoint would be to be the lateral to the base of the sacrum. And so, if I find my L5, find the base of the sacrum right there. I'm going to go a little bit laterally here, and I should be on that joint right here. So I'm going to go ahead and I'm going to lift up her right leg into 90 degrees, and then I'm going to go ahead and I'm going to internally rotate from her hip. I'm going to move her leg side to side just like this, and I can slightly feel that joint moving as I internally rotate from the hip joint here. Okay, I'm going to go ahead and relax just like that. And the last thing I'm going to go ahead and find is the sciatic notch. Okay, so what I want to do once again is I'm going to go to my PSIS off of her left side. Okay, so right here at the PSIS on the left side, and then I'm going to go ahead and I'm going to find her greater trochanter on her right side. Okay, which is right here. Okay, and then from here I'm going to draw a nice imaginary diagonal line up to her right glute, and right here should be the sciatic notch. You're not necessarily going to feel it and feel the specifics of the notch, but its general vicinity is right here in the middle. Okay, just right there. All right, and those are my palpations. I hope you learned something from the video. Thank you very much.